Hello, everyone. My name is Rachel, and I am a registered nurse from Ontario, Canada. I'm going to be presenting to you today with respect to the nursing management of radial arterial lines for some evidence-based practice. This is a presentation based on a recently published study authored by, as you can see here, Nancy Hanron, Lisa Letourneau, and myself. So this is a poster presentation that was created based on the paper that we completed and the research that we completed. So I will be going through this poster throughout this PowerPoint presentation, and you will see that we will go through each one of these sections individually, and I'll be discussing each of the implications here. So the background of this paper was to review new evidence and devices for improved management of radial arterial lines, and that can support nursing practice in critical care. For myself, just to do a quick disclosure here, myself and Lisa were paid per diem by Radial Medical Products to help support them clinically and perform some research. One of the questions that we were asked, we had 5 of us at this round table, 6 of us at some points, 6 women got together discussing sort of some of the gaps that were available and some of the pain points that clinicians as well as the Radial Medical was presented with. They were asked by their end users, which is us, nurses, to be provided with some research to support just the use of Armboards or some of their medical products. So we did find that Armboards have been around for years, various different kinds, and have been well documented in the use for insertion of radial lines. So we thought it would be easy to find clinical evidence to support that they are necessary and sort of the nursing role that was played in that. And we found a big gap. We found a big hole in where the research was. There was lots of stuff to support and about radial arterial lines from a doctor's perspective and their role that they play within the radial arterial line scope, which is generally the insertion. But in critical care, when a arterial line is inserted, once it's done, it generally falls onto the nurse to manage and maintain that line, but also be able to provide that patient care based on the information that you receive from that radial arterial line. So consistently, radial arterial lines were listed as a requirement for the insertion, and they are discussed in the INS standards, the Infusion Nurses Society standards, but nurses are also sort of reporting that they don't have the tools available to them in order to meet those standards. So we'll go over the standards now. Just for the context, I will let you know the paper itself uses the abbreviation RAL for radial arterial line. You will hear me refer to it as an ART line just because that's what I'm used to. That's what we kind of call it in my practice. So just so you know, we will use the term ART line, arterial line, and RAL interchangeably. Okay, so here's the INS standard that the joint stabilization such as armboards or splints should be used to facilitate infusion delivery, maintain the device functionality. For us, that would be the ART line itself, and minimize any complications. That they should be padded and support an area of flexion like an arm, elbow, or foot. So we do know the wrist is certainly an area of flexion, and it is obviously the place where the radial arterial line is inserted. So it should be applied in a manner that prevents visual inspection, and it's not going to cut off any circulation or reduce or cause any pressure injury or nerve damage. And one of the other things I'd like to highlight here is section B, where the use of wooden tongue depressors is not recommended, especially for preterm or immunocompromised individuals due to a high risk of fungal infection, or sort of what we found was like the opportunistic infections. Okay. So some of the background, so we're going through the first column here of the paper. So the background itself, nurses reported that at least 50% of their critical care patients did have an art line in situ at some point during their care, and that was used for identification of the hemodynamic status changes and things like that. That the nurses were the primary responsibility for caring for patients with the radial to arterial line, certainly within the context of a medical team, but it was that the nurse themselves was assigned one patient or two patients, and they were the ones with the radial arterial lines, and it was sort of up to them to maintain them once it was inserted. That the stabilization of that art line is essential to patient safety, and that Armboard devices, there's Armboards on the market. They've changed. There's lots of things like that, but there's never really been a formal review, or and this is sort of the gap that we were able to identify. No formal review, no critical. There's no studies out there, and critical care nurses were not consulted in any way, shape, or form about how to use these tools within their role and their scope. And just large gaps exist within practice literature with respect to the nursing management of radial arterial lines. So this is a kind of a busy slide here. This is just some of the literature. One of my responsibilities with respect to this project and this paper was a literature review. We all kind of brought to the table anything that we could find, but we ended up, I sort of put all the literature together, and it was extensive. It was many studies. It took us about a year to complete this study, and the literature review, we did a comprehensive literature review before we started, and I continued all up until the date of publishing, really, to ensure that there wasn't anything updated that we could include or that we could reference when conducting and publishing this paper. We did find some highlights. A lot of stuff was certainly backed up because it was repeated multiple times. And so here's some of the stuff that we found. One of the most common complication of that radial arterial line is the temporary occlusion, often caused by the bending of the wrist. And that the radial art line or the radial cannulation site is one of the most common places used. So we've completed this section here, and now we're moving on into the methods section. So the methods section here, we had a mixed method approach. So we did two different phases of this study. So we did have a survey that was conducted where we had 21 questions. We did research these questions extensively and base them on whatever research we could find. We used Likert scales, and we ended up getting 68 completed surveys. From this group as well, we also then from the survey asked if anyone was interested in being a part of a focus group. So then this is where the mixed method comes in. We got that quantitative research from the study, and then we certainly solidified it with the qualitative piece of these focus groups. So we found 6 critical care nurses who met eligibility criteria, which was 5 or more years of critical care experience as a registered nurse, and that they'd used radial arterial lines. We're going to be discussing in a minute the plethora and the scope and the widespread kind of access to nursing experience that we were able to capture in this study. Prior to the focus groups, each of the focus group nurses, all 6 of them, did receive 2 armboards. One was the rigid armboard, and one was the flexible bendable armboard. And then they were given a description of the armboards, and then we had general questions about the armboards itself. So I'll just show you quick pictures of what armboards that we were covering in the study. So this is a rigid armboard. So each one of the nurses did receive a sample of an armboard that looked like this. Very common It is just non-bendable. It's cardboard or plastic in the middle, usually covered with vinyl, and nurses need to use tape and gauze, or other things to help support and have the wrist kept at the angle that is appropriate and necessary for their radial arterial line. The next option here is we had a preformed radial arterial, or sorry, armboard. You can see here it's in one specific angle, and it has two straps here that are holding it on. So there's not necessarily a need for tape, but even still, nurses, and then there's a foam piece here for padding. Flexible bendable, so this is in one position, as you can see here. However, this is also another sample that was given to the focus group nurses, and this has an inner core that you can actually bend, and you can form it to whatever sort of angle is appropriate for your particular patient. You know, in the critical care context, even sort of in the course of the line being in situ, there is a different angle, different place so that the art line works the best, and so this one allows you to change that as needed. It also has large straps here, and has a soft foam padding. This is the final example. This is what we might consider a jury rig, makeshift type situation, where the whatever's around the hospital, nurses are taking so ingenuitous that they take what they have on hand to create the necessities that are required for, you know, that patient care. So tape, gauze, tongue depressors, which we've talked about is contraindicated based on the INS standards. And some of the major concerns with this one is going to be your skin breakdown, your alarms going off, line failure, and certainly infection. So we've just completed this methods piece here, and we'll be moving on to the results piece next. So this is what I'm speaking to when I was demonstrating from the study how widespread we were able to access. So the nurses that we reached, we had 68 of them that completed the survey, and then remember the 6 that we had for the focus group came out of this same group of 68. So all of the focus group nurses did complete the survey. Now, we did have some pretty high numbers here. So we've had, you know, the lowest minimum amount of people who has completed the survey was 3 years of experience, but the maximum here is, you know, people who are responding show that they had 42 years of nursing experience, or 35 years in an ICU. So we did really capture a wide breadth of nurses at multiple points in their nursing career. Further to that, we did see the critical care beds in a hospital. So these are nurses who are working in smaller hospitals. These are nurses who are working in huge hospital settings where there's, you know, so many ICU beds. We kind of captured, you know, somewhere in critical care, somewhere in the emerge, somewhere in PACU. What I do also like to see here is that this is research that does capture the pediatric population, which is certainly often not either captured, or, you know, some of the research kiddos are much different than adults. So we do have some of that influence in here too. These hospitals are spread out. So we have hospitals that are working in a more rural environment, which provides its own very unique circumstances, as well as urban centers where we have the most complex kind of cases as well. What I was speaking to with the adult population versus the child population too. So we do have some influence for children, and you know, speaking to some of the global population as well, between Canada and the US. So we do have lots of nurses kind of cross-border, although it is North America, but we did have, you know, this is results that do show that the healthcare systems on either side of that border we can find themes that are relevant to both of those things. Okay, so here are some other survey questions that we asked, and then we just asked nurses how much they agree or disagree in these types of situations, and that related to the nursing management of the radial arterial lines themselves. So we're seeing here that yes, in most cases, it is the nurse's responsibility to monitor the radial arterial line after it's been inserted. That is essential for patient safety, that we do need to visually inspect, that part of that nursing management does include the adjustment of the wrist angle from time to time, and that art lines can fail because of that wrist movement. Simple fix, but it can lead to a lot of failure, and that's identified as by nurses. False alarms is another significant concern, not only for patient safety, but also sort of workload management, and using armboards, or something, any kind of armboard to stabilize. Yes, some said yes, some said no, some said not applicable. So further, some more results here. So should armboards be used on all patients? The answer is no. Not all of them need art line, or not all art lines need armboards, but some may. Some nurses believe all art lines need armboards as well. So is it part of your hospital policy to use an armboard? Some say yes, some say no, some say it's not applicable. Interesting spread here when it comes to what kind of armboard or support device you might want to consider it, considering we have that makeshift MacGyvered or jury-rigged, some people might even call it DIY type armboard or support, is used in a significant amount of cases. Rigid is as the most popular. It's still going to require some MacGyvering to make it work for the variety of patients. That preformed is pretty popular, and the flexible bendable is certainly a less popular thing. And which one do you prefer? So the preference is for the least popular, least commonly used one, which is that flexible bendable armboard. So just in interest of time, I want to highlight a few of our other results as well versus the importance and the features that are important in an armboard for nurses. I wanted to indicate, so these are extremely important and important. This is approximately, almost 100% say that the stabilizing, one of the main features is to stabilize that radial art line and to get those accurate blood pressure readings and increase in patient safety. I thought this was an interesting statistic to point out, that this is one of the only things that they didn't think that was the most important. So this is sort of the least important thing on this list, if they could choose. That is easy to apply. And that, I think, speaks to that nurses are more interested in supporting their patients, and the fact that there might be an inconvenience for them is a lower on the priority list. So further, we are going to be doing the practice implications next. So we found that 100% of the critical care nurses reported that patient safety with the radial arterial lines is sort of the responsibility of the nurses. And so the stabilization, the continuous visualization, the monitoring for skin breakdown and infection, and accurate blood pressure medicines were the priorities for the critical care nurses. And that, lots of lack of availability of these tools to manage those radial art lines and to meet those INS standards. So too often we're forced to jury-rig these types of tools, and these outcomes can actually be quite costly financially to hospitals, but more importantly to patients themselves and their outcomes overall. Mortality and morbidity is, it falls in there as far as the highest cost anyone could pay. So nurses do find that there is a preference for these flexible and bendable armboards, but they just didn't have them So nurses are not given the up-to-date tools to perform the best practices and to keep patients safe. Just a quick review of the INS standard once again, so that we can highlight some of the things that we touched on and that we were able to identify in our study were not only important to nurses, but also considered important to the INS standards. So that stabilization like an arm board should be used to maintain that device functionality, padded as needed over an area of flexion, and visually inspect and reduce any sort of skin breakdown here. And that wooden tongue depressors, which speaks to the fact that many nurses are required to jury rig things in the hospital to make these outcomes. So this is our final thoughts. We are not presenting you today here with groundbreaking, earth-shattering research, but it is so interesting to see that nurses are not going to talk about these shortcomings in the nursoscope, and it could be for many reasons. They may not know that these products exist, and then they're forced to use these makeshift alternatives. There is so much pressure put on the nursing staff by hospital administrators, but I can't imagine that there is any more pressure out there than the pressure that we put on ourselves as a nursing group to be excellent at our jobs and just to provide the best possible care and outcomes for our patients, because that's why we show up every day. And that following the standards of care are so touted by hospital administrators, but then not given opportunities for nurses to actually participate and practice within those standards of care, because those tools are not made available to them. And one of the nice things too is, cross-border research. This is research that was conducted in both the US and Canada in the same study. So, we can show that this is, at least within North America, relevant, informed information. And we performed the study during the pandemic. We met virtually, weekly, and then, the study itself was performed virtually as well. So we used a lot of the same technology to perform the study itself as to study the research participants. A quick special thanks and acknowledgement to Sharon, Kristen, and Shelley. As I said, there was 5 or 6 of us, all women, sitting around this table weekly, dedicated, involved, asking those hard questions, and putting together this research and these. And Shelley did such a fantastic job of this, moderating that focus group to make sure that everyone stayed on track and the questions were asked and that conversation was given. Now, sponsorship for the research given by Dale Medical Products as well. So here's the final Radial arterial line poster. Here is a snippet of some of the references that we covered. Those are the ones that were indicated on the poster itself. But I did want to thank you very much for your time. Again, my name is Rachel Batty, and I would be more than happy to hear from any of you. The study is published and it is open source, so you are able to access it if you would like. This is Nursing Management of Radial Arterial Lines, Evidence-Based Practice is the title of the article if you would like to read it for yourself. Thank you very much for your time, and I wish you all